Hi everyone, and thanks for joining us today for our HIPAA compliance in the cloud and in the data center webinar. I'm happy to introduce Jan Ness, CEO of Online Tech. He'll be moderating our webinar today. And joining us is our special guest speaker, Joe Deluski from AT&T Group. Joe is a certified HIPAA specialist and HIPAA security specialist. And with no further ado, I'll turn you over to Jan.
Thanks, April. Welcome to the webinar. We're going to try to bring some clarity to HIPAA, what it means, sort of recent developments, talk about how you can know if you're responsible and what it means to you, how it affects you, and then we'll get into how you can do HIPAA compliant computing in the cloud. So we'll start back at the beginning for a second. Joe's got a lot of years doing this and does many audits, done some at our data centers. And so I'm gonna kick it off simply. Joe, why don't you describe what is HIPAA? What does it mean? What does it stand for?
Thanks, Jan. HIPAA was actually developed in '96, and the acronym stands for the Health Insurance Portability and Accountability Act. And in the beginning, it was formed to help people in the public with insurance portability. And with that, they also built some administrative simplification that involved a lot of electronic medical record technology and other components to that. So within that, they built a series of privacy tools around all of that, in the administrative piece.
What was the sort of, is there a couple sort of pillars of things that they were really trying to go after? Is when they I mean, it's a big complicated laws, but were there a couple pillars there?
Yeah. The two big things they tried to accomplish was, like I said, one was to make it and went to another, they could continue coverage. So, for example, Cobra was one of the products of HIPAA. The second thing is they recognize that about 30% of all the costs of healthcare were tied up in administrative costs. So they attempted to add some simplicity to the administrative piece of it. So the whole idea of EDI in healthcare was introduced in HIPAA. However, they recognized that when they start exchanging data electronically, that there had to be some privacy and security rules protecting the confidentiality, the integrity, and the availability of that information to both process business operations within healthcare and then also protect the data that patients would need to receive care.
So the three pillars you mentioned were confidentiality, integrity, and availability. Give us some real-life examples where, why they focused on things like confidentiality. Okay, everybody kind of gets that. Integrity, sure, but on something like availability. Why would regulations care about availability?
Well, and that's a great question. It's important, too, because most of the people who have heard the word HIPAA really relate it to privacy in the doctor's office or the confidentiality of information. But truly, think about a situation where you had a child in an ambulance, and apart from the confidentiality of that patient or that child's health information, it's also important to have it available when it's needed. In terms of if you're out of town and going to a remote hospital, the availability of that information is key. And the second part is the integrity, that the information that is provided to the caregiver is in fact valid, right? And that's a great example is you're on vacation and you have to receive treatment. It's important to understand that maybe that child has an allergy, or you need that information available because there's a prior history of treatment there that the doctor, the attending physician needs to know about.
Okay. Interesting. So confidentiality, availability, integrity makes sense. So what are some of the recent developments? I'm reading a lot about, some big heavy-duty fines, and I know there's some recent high-tech acts and so forth. What's going on with it lately?
Yeah, that's another good question, because for the longest time, for 13 years actually, everybody focused on the privacy of data, and it was simply because within the healthcare market, the whole idea of electronic medical records had not been proliferated to the degree that they felt it was extremely critical. However, in 2009, as part of the ERA, American Reinvestment Recovery Act, there was an act within that called HIPAA, and it was specifically designed to propagate all of patients' electronic medical records. And there were incentives offered to physicians in private practices as well as institutional practices to implement and adopt electronic medical records. And with that, they saw some need to put some teeth around the protection and the availability and the integrity of that data. And the whole idea was to take the data that resides in one location where patient care is provided and then offer that same data across multiple organizations for access. And the idea here, again, was to continue to drive down the cost of healthcare through the use of electronic means. And HIPAA changed as part of that because, again, they had to put some tighter rules around making sure that the data was kept secure. All right. A couple things happened. One is they changed the enforcement levels on HIPAA violations, and they started looking at organizations that either took care of it, in other words, did the due diligence that they needed to protect the information, versus organizations that willfully neglected their responsibilities to protect that data. And there are a series of fines and escalated fines as you go through that spectrum. The other key component to high-tech was that business associates of covered entities, and a covered entity is typically the insurance company, the hospital, the doctor's office, and a business associate is an organization that provides services to those covered entities. And it could be anything from IT services to document destruction to clinical staffing. That now the responsibility of HIPAA compliance falls not only on the covered entity, but the same level of responsibility and liability falls in the hands of the business associate. So if there were a breach, and that was part of the new high-tech act? Yes, that was part of high-tech. So if there were a breach and it was in the hands of the business associate is held equally liable.
So what's a business associate? Give me, and covered entity, describe some of those two terms.
A covered entity, the best way to look at a covered entity is somebody who provides the treatment, payment, and operations in healthcare. So it could be a doctor, the dentist office, a hospital, a home health care agency.
And what about an IT company that services one of those?
They're considered a business associate. So any organization that provides services in support of the treatment, payment, operations are considered a business associate. Real common examples at a physician's practice are an IT company, perhaps a billing company, a company that handles all of their billing and claims processing, a document destruction company, a telephone service provider, and so on, an accountant, a lawyer, and anybody who may have access to patient information, whether it's directly or indirectly, physical or virtual.
Okay. So that's a business associate.
Yes.
Okay. So how do I describe a little bit more? I think you might have a diagram here too. How do I know if I'm responsible for, I think the term is PHI, maybe you could describe what that is, and then if I'm a service provider, how can I tell whether or not I even need to worry about this stuff?
Well, there are two, and I'll provide kind of a two-part answer to that. One is going back to the definition of a covered entity. Ultimately, the covered entity is responsible for the protection of that information, and it's incumbent on that covered entity to do business with business associates who also realize and understand the protection of that information. And it's the covered entity's responsibility, as you can see in the diagram, the covered entity's responsibility to identify the locations or who might have contact with that protected health information, PHI, and then do what they need to do in terms do the due diligence to make sure that their business associates are in fact compliant and putting the necessary safeguards in place to protect the data.
Okay. So, if it does, let's say I am one of these business associates, how does it affect me? What do I need to do? I inherited a business associates agreement. What do I need to focus on?
It's a great question as well. So whenever I work with business associates, I kind of separate the activities of the business associate. So the business associate has responsibilities from an institutional perspective to achieve and maintain HIPAA compliance in terms of all the internal administrative, physical, technical safeguards. The second piece to that is the solution they provide, right? So, and there is a difference between an organization and the business. In terms of the solutions, there are business associate agreements in place, and a business associate agreement is a standard document that basically defines what does the business associate do in the relationship and what does the covered entity do in the relationship, and it separates the responsibility. Okay, so it clearly pinpoints what each party is responsible for. The other key piece in a business associate agreement, and what I find is that a lot of organizations sign business associate agreements. Within that, it says that they'll take reasonable steps to implement the appropriate administrative, physical, and technical safeguards. And those three items are not just vague industry terms. Those are very specific HIPAA standards.
Okay. So let's say I'm a service provider and somebody wants me to sign a business associate agreement. Should I sign it? How do I know whether I should sign it? How do I even know where I am?
There's a couple things I would do. One is I'll always consult legal advice before signing any contract. The second thing is understand where you are from a HIPAA perspective as an organization, and the way to accomplish that is through a HIPAA audit.
And what's a HIPAA audit? How does that work?
A HIPAA audit is, and if anybody's ever been through an ISO or a PCI audit, it's based off a set of regulations, standards, and implementation specifications. And the audit is a gap analysis to talk about what are the standards, where does that organization sit, and what steps need to be taken to get them to compliance.
Okay. And if I'm going to provide services to a covered entity, or if I'm going to have an application that I might host in a cloud that would deliver to a covered entity or to a provider of a covered entity, I need to get one of these HIPAA audits?
Yes.
And how often do you do an audit?
The HIPAA has an actual piece of the regulations that's called an evaluation. So once you perform that and you take the steps necessary to become compliant, you have to have a periodic evaluation to make sure that you remain compliant. My recommendation is once a year, and that's specifically at a minimum once a year, and that's because technology changes, different components are added to an organization's infrastructure, and they should be reevaluated.
So sort of circling back for a second to these fines and sort of more recent developments, I understand it's the Office of Civil that does the fining. What are they called again?
Office of Civil Rights, yeah.
And you know, is it sort of, you do this audit, you do this thing once a year, are those are all the things you do as evidence that you're not guilty of any willful neglect?
Yes.
I mean, so basically it's insurance against some of those.
Yes. I mean, the key thing to remember is you always, in any compliance, especially where you're trying to protect information, you always have a human element, things you can't control. And if there were, in fact, a violation, and the Office of Civil Rights were to investigate that and enforce these rules, they look at the degree of effort you've put into becoming compliant. If you are in violation, you will be fined. But the degree to of that fine depends on how much diligence you've done to protect yourself and become compliant.
Okay. Talk to me about these fines a little bit, because the audits aren't really that cheap. And so describe for a second what the audit costs and explain, and you know, sort of the penalties, the fines. Give me some magnitude. Whatever.
All right, I'll give you. There are 4 categories of HIPAA violations, and I'll give you the minimum fines and kind of maximum per year. There's a category called due diligence. In other words, a violation happens, but the organization has taken every step possible that they could have foreseen to prevent that. And the minimum fine is $100 per incident. Okay. On the second category is called reasonable cause. So in other words, the steps have been taken, but it takes you into that next category where perhaps something wasn't addressed. But so for example, a company went into a HIPAA audit, they provided a gap analysis, but something wasn't addressed, hadn't been addressed yet. Then the minimum fine moves up to $1,000 per incident. Okay. Those are the minor fines, and then you get into what are the major fines, which is around willful neglect. In other words, you ignored it. Okay, and the minimum fine for the base willful neglect is $10,000 per incident. And then you also have a second category of willful neglect where it was pointed out and you did nothing about it. And there I'll talk about the maximum fines of up to $1.5 million per calendar year on those incidents. So it's really broken down, and it really depends on how much effort you put into becoming compliant.
So the ones we've been reading in the paper lately, those must be, you know, the really willfully neglected cases. Those aren't the $3 and $4 million fines that were levied recently to some hospitals. So
yes.
Those are pretty gregarious.
Yes.
Behavior.
Yes.
Okay. All right. So can I?
No, the other piece to this that's important is that there's also a separation of civil and criminal penalties attached to HIPAA. Okay, so the civil penalties are things that we've been talking about where there are violations. On the criminal side, in the example of theft of data, that can be prosecuted criminally with prison, 10 years of prison possible, and hefty fines associated with that.
Okay, so that's like if I knew I was stealing the data and I was, you know.
Or if there was some type of systematic data theft where somebody knew they had patient data and was systematically taking it from a business perspective and selling it.
So could I just not sign any business associates agreements and just, you know, say I don't sign them as a way to avoid any of all that?
It doesn't matter. If you have protected health information and you know you have protected health information, then you, by law, are a business associate, whether you sign an agreement or not.
Would not signing agreement be looked at as, you know, bordering on, hey, you know, you didn't a little willful neglect there? Or?
It would certainly raise eyebrows, yes. If you knowingly and purposely didn't sign a BAA because you knew you weren't in compliance, it would certainly raise flags.
Okay. So in summary, it's all right. Confidentiality, integrity, availability. Get an audit. Do a business associates agreement that you and your lawyers can live with, and that's all sort of the you know, regulations and compliance side. Now let's move a little bit to sort of the IT and how do I make. I agree I'm going to go do those things. I see I got to go do those things. I've got this application. What are some things that are important about looking for a cloud provider as I figure out what's the cheapest and most effective way for me to meet all of that criteria, but still get the benefit of cloud computing?
Well, I think the key thing to understand in going out and searching for a solution is that the covered entity, the organization that uses the information for treatment, payment, and operations, is ultimately responsible for making sure that that data is protected. Okay? From a business associate, if I'm out looking for a partner to help me in a cloud computing environment, there are two things that I'm going to look for. One is that the organization themselves are compliant from an institutional perspective, so that they've gone through all the safeguards, they understand HIPAA, they have training around it, et cetera, et cetera.
So that means that they have a HIPAA audit themselves?
Yes, that they've gone through a HIPAA audit. The second is the actual solution itself is HIPAA compliant, and there's a difference. There's a difference in that.
Go into that a little bit.
Okay.
How is that different?
So I'll kind of talk about the differences. So from an institutional perspective, there are a specific number of policies and practices around being in institutional compliance, making sure my employees are trained, making sure that the physical security around my building is safe, things like making sure I understand who is accessing my client's information.
And is there a list of specific prescribed things that you need to do and this audit uncovers and do or document?
There are general regulations. However, HIPAA is, so as strict as it may sound, HIPAA does not prescribe very specific technical solutions to all of those. It allows you to take reasonable steps. Okay. And the reason for that, Jan, is HIPAA was designed to be scalable from everything from a small one-doctor physician practice up to a large multi-campus health cover or health entity. But the degree to which those are implemented it has to be reasonable and depends on the operation. So that's the covered entity side, right? Okay. On the compliance around the institution from a solution perspective. And I'll just lay out an example of an organization that does, maybe they do off-site cloud-based backups. Okay, so a physician practice wants to take the data from their servers and from their workstations and somehow back that up. In order for that covered entity to be HIPAA compliant, they have a backup routine that sends it off to a cloud. Well, within that chain of events that happens, there might be 2 or 3 organizations that ultimately touch that data. There might be an organization that sets up all of the backup environment, that maybe resells this backup environment. And then there might be a hosting center where the data is eventually stored. Well, that talks about a chain that makes up a solution. And that solution
circuit maybe, or the the circuit that it transports on.
Well, the HIPAA is clear about that, and it names the circuit carrier a conduit. Okay, and a conduit, believe it or not, a circuit provider falls into the same realm as the United States Postal Service or FedEx. They actually move the data from one point to another, and without having,
considering agnostic or anonymous
yes.
users of it. So they have so they're not covered under the BAA. So it's the IT guys that set up equipment at the doctor's office, and it's the hosting company you have to focus on.
Yes. Okay. Right, and that's what constitutes a compliant solution, is making sure that those individual pieces are compliant. Okay. And then understanding that, for example, the data in transit must be encrypted. Right, that all makes up part of that solution.
So you've got to use things like VPNs with data encryption, or does a VPN not matter as long as it's encrypted, or can you even use a VPN, or do you have to use a private circuit, or is it non-prescriptive?
No. Many healthcare organizations use VPN technology to accomplish that.
But they encrypt it at both encrypt at both ends, or
yes.
Encrypt it the whole time at the hosting company,
or within the VPN itself.
Okay.
Right, within point A and point B of the VPN, there's encryption.
Okay. Does it need to stay encrypted at the hosting company, or if you wanted to decrypt it and do something with it, the hosting company, is that create any issues, or how do you need to make sure you can do that?
Technically, yes. Technically, the data at rest and data in transit should be in an encrypted format. For example, an organization that distributes an electronic medical record software, they have requirements within the software development piece of that to make sure that data at rest is encrypted. Okay, or if data is being transferred from point to point, it's encrypted. Which brings up really a whole separate side, because the EMR vendors and application vendors, they have to have certain requirements within their development and usage of that software that maintain that HIPAA compliance. Okay. Right?
Yeah.
Individual unique logins, automatic log-offs, the ability to have monitoring and logging.
Yeah. Right?
And technically, you should be able to account for the usage of any kind of electronic medical records, whether that be in an EMR format or even if it's an Excel format. You should be able to track who used it, who touched it.
Okay.
Another interesting piece of recent legislation is that now the public, and this is really, it's in the discussion and debate mode right now, but the public is going to have the right to have access to all the uses and disclosure of any of their specific protected health information. And it's incumbent on the covered entity to be able to use a software that provides that.
So just for take example, I should be able to call my doctor, and he should be able to give me a list of everybody to whom he, according to their systems, said has accessed what of my data.
Yes. So if you think about that, you can go to a doctor's office and they may send a prescription from point A to point B. They may send a lab request, and that lab request sends back information. There might be some type of litigation where by law or by subpoena the information was disclosed. All of that has to be, in electronic format, has to be provided to the patient. And it's in discussion right now.
So if I'm a SaaS provider and I'm providing one of these EMR systems, or I'm providing a billing or something like that, basically I need to build a bunch of monitoring and logging in my application to be compliant with that, because I'm going to have to generate some reports for my users that tell them where data is. I'm also going to need to build, if I'm going to put in a cloud architecture, I'm going to need some kind of architecture that I know is going to keep my, what are the three, my data confidential, so encryption. You got to be behind firewalls, your own firewalls, you want to use private networking, private network addresses, your own VLANs, your own private hardware, in fact. And for availability, you need to have somehow, some way that you're always able to, you know, very, very high availability architecture plus some kind of a DR, off-site backup component. And those, all of those things, drill downs, are not covered sort of prescriptively by the HIPAA audit, but basically the effect of those things have to be in place as described, as requested by the HIPAA audit. Is that right?
That's exactly right. And it all stems, the root of all this is the location of the protected health information. All right, and as you kind of build off the location of the PHI, you start identifying things. So for example, the great point, Jan, in terms of the isolation of that information. So if I'm going to implement a cloud-based solution, and I think it goes without saying, I've got to be ensured that my protected health information is securely isolated from anybody else's inside or outside.
Even if it is encrypted?
Even if it is, yeah.
Okay.
Yeah.
Time to wrap up here. Couple takeaways. What are a few things that people really need to make sure they do no matter what going forward here?
Well, one thing is, you know, don't ignore it. It's out there, and ignoring it is the worst thing you can do. If something does occur where you're contacted by the Office of Civil Rights, treat it like you would the IRS, right? Respond prudently, honestly, and promptly to any inquiries. And the worst thing you can do is be in denial. Don't vary that responsibility. I encounter a lot of organizations that try to rationalize why they shouldn't be HIPAA compliant. And I advise don't take that route. At least understand to a minimal degree where you need to be compliant and if you have responsibility and liability in that. Because the worst thing you can do is ignore it and willfully neglect it.
Right. One of the things we try to encourage our operations team to do, in fact, we demand it, obviously, we see a lot of data, right? Not just HIPAA, but PCI. We see a lot of encrypted data and a lot of packets going around. And we all remember, you know, some of that data might be us. It might be our data, it might be my Social Security number, my credit card, my PHI, my personal health information, so or your own, and treat it as confidentially and priceless as you would yourself. And so you're concurring that that's like an IRS audit. Get an audit you would encourage. You could go get a PHI audit.
Yeah, handle the whole thing like you would taxes and accounting, right? I mean, get some help in understanding what your responsibilities are, and in the event where there's a reaction necessary, you know, handle it prudently and get help in that.
Okay. Joe, I really appreciate you coming in today and sharing your expertise with our fans online.
My pleasure.
Thanks so much, Jan and Joe. We will be emailing a link to our presentation as soon as we get it posted up on the website. And if you have any follow-up questions, please feel free to send them on to us. And thanks to those of you who submitted questions in advance. That helped us to put together, hopefully, a more meaningful webinar. Join us next week with Adam Goslin and Mike Klein. They'll be discussing network and application security. We'll hope to see you next week, Tuesday at 2. Thanks, everyone.